Hello, this is Dr. Gay from First Look MRI, and this is a 16-year-old female who complains of a palpable abnormality over her fourth finger. So this is her fourth finger, ring finger, and we see that she does have a little ovoid area right here over the palmar aspect. This is the hand down here, this is the palm, this is the tip of the fourth digit here, and we see we have a dark band called the flexor tendon coming across, and right over the flexor tendon we have a sharply defined homogeneous signal intensity structure overlying that fourth flexor tendon. There's a marker that's been placed over it. That's what that other little round area is. And if we look on this view here, this is a view where fluid is bright, and we see that this is a fluid collection because it's homogeneous and very bright. Again, it has sharply defined margins, and it surrounds this little dark thing here. This is the flexor tendon of the ring finger. This is the bone, and that dark band is the tendon. And again, this is that cystic structure that wraps around. So in this location is a typical location to have a ganglion cyst, and it comes off the flexor tendon sheath. Again, this is the flexor tendon, has a sheath that surrounds it, and ganglion cysts can occur in this location. And when they do, they're called volar reticular cysts. So again, volar reticular cysts, and they're a variant of ganglion cysts, a type that is over these flexor tendons. The most common one is the third finger, followed by the second finger, and then the fourth, fifth, and first are the next ones to be involved. But these are a little bit different than the typical ganglion cysts, supposedly because they stay the same size despite activities where other ganglion cysts may change. And as far as treatments go, they usually resolve, or more often than not. About 70% of the time they will go away whenever you do a simple procedure like aspirate them or do multiple perforations within the cyst. Then the fluid will, or the jelly-like material will leak out, and again these will go away more often than not. Typical ganglion cysts will recur more often, and so they don't try to aspirate them or try to perforate them. They may go to surgery, whereas these you can have conservative therapy, and actually they'll go away spontaneously in about half the cases. And if they don't go away, they can again do the more simple procedures of aspiration or just perforation, and again they'll go away in 70% of the cases. So this is what we call again a volar retinacular cyst. It's a type of a ganglion cyst that surrounds the flexor tendons of these digits. Again, usually it's the second, third, or fourth digits most commonly involved. And again, these will go away spontaneously in about half the patients. And again, the conservative treatment of just aspiration or perforation is pretty effective. About 70% of the people will get relief with that. And let me put up another couple views here to show this. This is a view from the side where fluid is bright, everything else is dark, and this really stands out. You can see bright like a light bulb, very homogeneous. Again, a ganglion cyst of the flexor tendon sheath, also known as a volar retinacular cyst.